I found out.
We're talking to Mr. RCrowder, the founder of StreetWorks, and as well as an advocate of education for HIV and AIDS. And of course, Mr. Crowder, let's pick up where we left off the last time, trying to make a distinction between younger people who were impacted by this disease and perhaps older individuals who are impacted by this disease.
Okay, Dr. Haney, this is what's going on. Let me make it as crystal clear. What happens is, with the advent of new medications such as Viagra, Cialis, or in these other new medications, what is happening is, what we're seeing now is older men are seeking out, with this medication, younger women. Let me give you a good scenario. For example, you know, in what do they call it? Old high rises.
Okay.
For example, you got Mr. Bob who lives in the high rise.
Okay.
For
senior citizens.
Yes,
senior citizen
housing.
Senior
There you
citizen
go.
housing, all those high.
Okay.
Yeah. Okay.
Now, Mr. Bob got Miss Lucy for a girlfriend. Now, around the first of the month, when Mr. Bob get that check, Mr. Bob get him some Viagra or some Cialis or whatever.
Okay.
Then he goes out of the high rise. Now, we're talking the first few days of the month, right? Then he meets up with Tamika, or the younger woman.
Okay.
On the streets. Yeah, you see what I'm saying? Now, because he got this extra staying power because of this medication, he feel he got this, you know what I'm saying?
I understand.
Then, from the 5th of the month to the end of the month, he goes back to the high rise, and then it's business as usual with Miss Lucy.
All right. Okay.
You understand what I'm saying?
Now,
exactly that's how that, and again, that's what we're seeing.
You're seeing
we're
that?
seeing, yes, we're seeing that HIV is now in a whole new population of people. And this is just my opinion. There's been no research around this, so I couldn't defend it.
But you see it every day, and you're working with it, and that kind of situation.
This is let me say anecdotal information that I'm giving here. I wouldn't want to go on the record as saying this is definitive information. This is just my
what you see, and after having worked with it for the last 20, 25 years,
absolutely,
being intimately involved with it, you can make some kind of judgments in reference to. Yeah, go on. Yeah, I understand.
But again, it's the stigma. Now, while HIV has become a manageable disease, there's still that stigma and that shame that was associated when HIV was first introduced. Homosexual, drug addicts, and these kind of things. So this kind of behavior associated with the disease, and the stigma and the shame and the guilt associated around being HIV infected is preventing people from going to take the HIV test. But we must realize that not taking the test does not change the fact if a person is HIV infected.
It doesn't change the status.
Right. It doesn't change the status at all. And my suggestion is everybody has an HIV status. The question is, do you know yours? And you should know yours. Because again, early detection and early treatment is the key to a successful, manageable disease. Not successful, let me say manageable disease. So that's the bottom line.
You know, one of the things that we've seen, and I think you see it quite often, is dealing with body piercing. And why don't you say something about that? Because I think a large number of young people have become involved in this without even understanding or knowing the impact that this
Well,
would have.
well, when I said one of the modes of transmission was blood to blood, and that most occurs by sharing needles. And sharing needles, we need to say any type of needles. Now, with the advent of tattoos, body piercing, and all of that, you have to understand that long as those needles are not being shared by someone with HIV, then it's okay. But if you're going to get a tattoo, if you're going to have body piercing, just get it done by a reputable, licensed person, and make sure that they are using clean, sterile, and new needles, and you'll be okay. It's that a lot of times people go to the neighborhood person to get that tattoo Sean, tattoo Wayne, tattoo whoever.
All right.
Tattoo James Haney. You see what I'm saying? And those type things also have a risk for transmitting HIV, sharing needles.
And so that's the real problem.
Yeah. Well, we're not seeing a lot of that, a lot of people becoming infected that way, but we want people to know that that is a potential risk. So, you know, that's where that goes.
Well, now, over the next 3 minutes that we have here, Ms. Crowder, what about the research and the attempts to, have we simply given up on trying to find some kind of vaccine or whatever? Yeah,
well,
is that just?
let me tell you where we are with that. Number one, the United States is still, as we speak, over the last 10 to 12 years, there have been somewhere around 40 to 50,000 new HIV infections in the United States every year. One reason that is because the United States does not have a national HIV prevention strategy. We require that of every other country that we give money to, you know, for the National AIDS Fund, or if we give other countries like Africa or anybody fund their AIDS, we require that they have a national HIV prevention strategy, but we don't have one.
Well, why don't we have one, Ms. Crowder?
And that's a question for CDC. And again, we are advocating as we speak for that. We're advocating as we speak. I am a part of a national advocacy group called